Typically, patients with hip pain are going to present with discomfort in the front or in the groin, in the fold of the leg, sometimes on the side, but rarely in the back or in the buttock. Hip pain we diagnose with a history, and then we do a physical exam. I have a patient lay on a table. I'll examine your hip. I'll bend your hip up. I'll internally rotate it, externally rotate it, have you resist certain activities, have you do some squatting or movements to see if that reduces your pain, determine exactly what type of activities cause the pain. We offer a number of treatments here, everything from medications, which can be as simple as an over-the-counter medication such as ibuprofen and naproxen, prescription medications, injections such as steroid injections, physical therapy. I can refer you to work with a physical therapist, or I can just simply give you a handout sheet with exercise and stretches that you can do on your own if you don't have time to work with a physical therapist. If all that fails and you continue to have severe discomfort in your hip, we can do hip arthroscopy, which is an outpatient surgical procedure which takes about an hour to perform and has 2 or 3 small incisions about 1/4 of an inch long. After that surgery, you would be able to walk and you would go home, work with a physical therapist, and in most people make a full recovery over a 2 to 3 month period. If you have severe arthritis in your hip that wouldn't respond to a hip arthroscopy, they do hip replacements. And we can do those a number of different ways. The most recent method we do those is called a direct anterior approach, which is when we replace the hip from the front through a smaller incision, allows you to be up and walking on the hip the day of surgery. Also, there's a quicker recovery because no muscles are cut and there's no precautions afterwards. You can do any activity you want, from yoga to sitting Indian style on the floor. There's very little or no danger of dislocation. Most people return to playing tennis and jogging and doing all the activities.